The next up, we've got Katherine Henry. All right, Katherine is a mediator. She's a mediator, restorative justice facilitator, and attorney. She has her own law firm, Katherine Henry, PC. She also works with the Great Lakes Justice Center. She has worked in the legal field for about 19 years and is licensed to practice law in the state of Michigan, Saginaw Chippewa Tribal Court, Eastern District of Michigan Federal Court, as well as the Western District of Michigan Federal Court and the U.S. Supreme Court. So please help me welcome Katherine Henry.
She turned blood red in World War II. She hung limp and low a time or two.
Good morning, everyone.
Morning!
Hopefully you'll hear me over the honking. Most of you have come here today looking for a reason to have hope, looking for affirmation that you have the right to your basic freedoms. Looking for specific things you can do about all of this. My colleague, Dr. Martin Dubravik, and I have compiled both legal and medical information to do just that for you today. So who is this doctor I speak of, you might ask? He's not standing next to me. Well, Dr. Dubravik is busy treating patients right this very minute, and he regrets not being able to make it here today. But let me tell you just a little bit about why this guy is someone you want to listen to. Dr. Dubravik graduated from the University of Illinois College of Medicine, completed his residency in internal medicine at Fitzsimmons Army Medical Center. He then completed fellowship training in allergy and immunology at Walter Reed Army Medical Center. He is a member and fellow at the American College of Asthma, Allergy, and Immunology, the past president of the Michigan Allergy and Asthma Society. He is the founder of the National Board of Clinical Medicine for Allergy and Immunology, a member of the American Academy of Allergy, Asthma, and Immunology, and a member of the Michigan State Medical Society. Dr. Dubravik is one of these frontline essential medical professionals, and he is an expert immunologist from right here in Michigan. So what does Dr. Dubravik want to share with you today? Well, consider the press conference yesterday. Governor Whitmer said, "We can't make decisions based on feelings and fear." Yet, Dr. Khaldun followed and said, "Well, we are still just in the early months of fighting this virus, and everyone needs to be patient and stay the course with these stay-at-home orders."
Stay afraid!
Then the director of the Department of Labor said, "The worst thing we can do is open up our economy too soon and increase infection rates." The governor then said, "We are nowhere out of the woods, and it is in everyone's interest to avoid a second wave at all costs." So fear-mongering is the spreading of frightening and exaggerated rumors of an impending danger to purposely arouse fear in order to manipulate the public. Well, the statements we heard yesterday and the ones we've been hearing from them for weeks, that sure sounds like fear-mongering to me. Yesterday, the governor said, "We are making decisions based on the best science and data, decisions based on the facts." So what are the facts they're using? Or for that matter, what are the facts that we are given? We're given the facts of death and disease, but facts in a vacuum, facts selected to create fear. So what facts are we missing? The CDC actually explains the essential data that we're missing. The CDC. The provisional counts were given for COVID-19, you know, those daily death toll numbers that are announced on media every single day, what you get when you do a quick Google search. Those numbers actually include COVID-19 deaths and non-COVID-19 pneumonia deaths. So what does that mean? Well, of the 57,000 COVID-19 deaths that were reported yesterday, the CDC actually says that only 33,513 were actually COVID-19 deaths, the other ones just being non-COVID-19 pneumonia deaths. Wow. Dr. Dubravik and I realize that alone significantly changes the numbers that we've been given. But that's not all. The World Health Organization requires all member states to use what are called ICD codes for medical diagnoses and specific formatting and regulations for death reporting. The CDC boasts that they have strict compliance with these ICD codes and regulations, especially regarding death statistics. However, despite the World Health Organization specifically requiring all countries to report laboratory-confirmed COVID-19 cases under a separate code from the mere assumed COVID-19 cases, the CDC actually requires our doctors to report all assumed COVID-19 cases as laboratory-confirmed cases. Doctors are even told by the CDC to label deaths as COVID-19, quote, more often than not. If a doctor labels a cause of death as uncertain because the doctor who has seen the patient is not sure what is the cause of death, the CDC goes on to tell us that they actually count those in the confirmed COVID-19 death counts. For any diagnosis based on speculation alone, the CDC also decreed that it will not even follow up to see whether the diagnosis was confirmed one way or another. With this highly inaccurate and unusual method of COVID-19 reporting, actual laboratory-confirmed COVID-19 deaths are entirely unknown. Given all the CDC directives for over-reporting COVID-19 as the diagnosis, it is realistic to extrapolate a true COVID-19 death toll to be closer to about half of those reported, or only about 16,800 deaths nationwide. So what does this mean for Michigan? The CDC tactics to inflate the COVID-19 numbers apply in Michigan the same as the rest of the country. But let's look at some specifics. As of yesterday, Michigan.gov reports 39,004 deaths from COVID-19, those are COVID-19 confirmed cases on one spot of their website. You look at another spot of the same Michigan.gov website yesterday and you see 40,399 confirmed cases of COVID-19. So, just like the CDC, Michigan.gov reports two different sets of numbers in the same period of time. Now, the Michigan Department of Health and Human Services website tells us that COVID-19 deaths in Michigan are reported under the laboratory-confirmed code. All of them are reported under that code. So that makes the COVID-19 confirmed death cases look much larger than they really are. But there is even more misleading with these numbers. Let's take the April 18th data as an example. In the advertised COVID-19 death toll numbers on the main Michigan.gov webpage, we were told 2,308 Michiganders died from COVID-19. On the same date, though, the Michigan Department of Health and Human Services website reports that the total number of both confirmed and non-confirmed or assumed case deaths is only 1,408. So when our actual health department reports 1,408 COVID-19 deaths, Whitmer in the press is reporting 2,308.
We already know they lie! Talk about something that matters!
So when we are told that 3,670 Michigan people have died so far this year from COVID-19, we need to realize that that number is grossly overinflated. So even if we're counting confirmed and assumed cases, the COVID-19 death rate in Michigan is less than half of what they're claiming it is. So what's the difference between COVID-19 and the flu? We hear that the flu is no big deal and COVID-19 kills people and we're being irresponsible. How dare we come protest? We're also told that COVID-19 is super deadly. Well, nationwide, the flu and pneumonia, all this comes from the CDC, by the way. The flu and pneumonia claim an average of 55,000 people every year. Recent years have been much worse, though, with over 61,000 people dying in the U.S. last year from the flu and pneumonia, and 79,000 people died the year before that, right here in the U.S. In fact, the current flu season that started around October 1st, 2019, was predicted to be a, quote, particularly deadly flu season, end quote. And it was reported as early as October 2019 that this year's flu season is, quote, dominated with the H3N2 strain, which causes more hospitalizations and deaths than any other strain. Indeed, flu and pneumonia deaths this year are reported by MDHHS far surpass the number of COVID-19 deaths right here in Michigan. The flu, like COVID-19, is much more deadly for the elderly and the immunocompromised, with 84% of flu deaths being in individuals 65 years of age or older. Both the flu and COVID-19 are more deadly in minority populations. The main difference is actually that the flu, according to the CDC numbers, is actually 55 times more deadly than COVID-19 in children. But we're not afraid of the flu. COVID-19 and the flu are transmitted in largely the same ways. According to the CDC, COVID-19 and the flu have largely the same symptoms: cough, fever, chills, body aches, headaches, and the sore throat. And while we're comparing, so far this year in 2020, heart disease has claimed more than 5 times the number of lives as COVID-19 right here in Michigan, according to the Michigan Department of Health and Human Services. Cancer taking almost twice as many lives so far as COVID-19, with COPD and stroke also killing more than COVID-19. So what should we do about COVID-19? Do the same exact thing you would do for the flu. Wear a mask if you are immunocompromised or taking care of someone who is. Wash your hands frequently. Use bleach and alcohol when cleaning surfaces. Unlike with the flu, the U.S. Department of Homeland Security has actually found that direct sunlight, heat, and humidity are very effective at killing COVID-19. So go outside. What should you not do? Well, my esteemed colleague, Mr. Dubravik, and the World Health Organization recommend healthy people to not wear masks at all. In fact, they describe it in much more detail why on the WHO's website. And healthcare workers should stay away from cloth masks. Similarly, the regular use of gloves by people in the community is not recommended by either the World Health Organization or medical providers right here in Michigan like Dr. Dubravik. And stay-at-home orders? The CDC now calls for us to, quote, minimize disruptions to daily life, end quote. Regular physical activity is recommended by the CDC, much more than what the average person can get while being locked inside. The Michigan Department of Health and Human Services tells us, get this, that herd immunity is the best way to slow flu deaths. Well, a lot of other doctors, including Dr. Dubravik, explain that this is the exact same for COVID-19. Stay-at-home orders negatively impact the health of the people and are ineffective at even stopping the spread of the virus. By the way, all of this medical and governmental information is quoted and available at stopcovidchaos.com. So, if stay-at-home orders are bad for us and the COVID-19 death rates are nowhere near as bad as they have claimed, what should the legislature do? This is where my legal experience comes into play.
They need you to resign!
The legislature could either not vote to extend the state of emergency, or they could vote no on an extension. Either way, don't take a vote at all or just vote no. Either way would have the same result. Michigan Codified Law 30.403, enacted in 1976, clearly states that the state of emergency or state of disaster must be ended after 28 days unless the legislature votes to approve it, extend it. The legislature voted on April 7th to extend it to today. If the legislature votes against extending it, or if they don't even vote at all, the law clearly says the state of emergency will be over. This means that all of the executive orders issued so far in 2020 will immediately become null and void. This includes the stay-at-home orders. The orders restricting non-essential medical and dental treatments. The order releasing prisoners early. The order extending FOIA deadlines. The order restricting access to loved ones at care facilities like nursing homes. The order cutting off kids in juvenile detention centers from their families and support services. The order closing movie theaters and gyms. The order limiting restaurants to takeout service. All of it. But the governor said yesterday that the state of emergency is over when she says it's over, regardless of what the legislature does. She certainly did say that, but that's not true at all. The older part of our law, MCL 10.31, enacted in 1945, does not specify the 28-day expiration. So Whitmer has claimed that she can rely solely on this statute and circumvent the need for legislative approval for extensions to the state of emergency. However, this is not how our laws work. Our Supreme Court here in Michigan has explained that, quote, all statutes relating to the same subject must be read together, even if enacted at different times, end quote. If Whitmer were allowed to create an executive order where MCL 10.31 is followed and ignore the requirements of MCL 30.403, then that would mean she gets to pick and choose which laws apply to her actions. She clearly has no authority to do that. And when asked this very question in the press conference yesterday, she never even answered how the law would actually allow her to do that. Keep in mind that if she could do that, we would have no system of checks and balances, because the governor would have total authority over our state, including the ability to set aside or completely change the laws properly enacted by our legislature.
Our governor's on
This
drugs!
absolute executive power does not exist anywhere in the U.S., and it is not found in any statute or constitution provision. So what if she tries to extend the state emergency on her own authority anyway?
Hang her!
It would clearly go beyond the bounds of the Emergency Management Act and would be illegal on its face. No law enforcement officer could enforce it. No prosecutor could prosecute individuals who violate it. And again, that goes for every single executive order she has issued in 2020, as they are all based on the governor having these emergency powers in place. But Governor Whitmer already knows this. She knows this. Since at least 1930, our state Supreme Court has held that, quote, a statute must be interpreted in a manner that ensures that it works in harmony with the entire statutory scheme, end quote. And that is why she actually references the Emergency Management Act of 1976 and the Emergency Powers Act of 1945 in each of her executive orders. There have also been rumors that she might also simply issue an entirely new state of emergency if she doesn't get her way. That is not legal either. Our appellate courts have made it clear that, quote, statutory language should be construed reasonably, end quote. Given the explicit 28-day time limit required, it is not reasonable to interpret MCL 30.403 and MCL 10.31 to allow a governor to circumvent the 28-day time limit by simply issuing new orders that address the same emergency conditions that were in the original order.
No do-overs!
In fact, in the 87 states of emergency or disaster that our governors here in Michigan have issued between 1977 and 2019, since the passing of the Emergency Management Act, the legislature has voted to extend them a total of 10 times, but none have ever been unilaterally extended by a governor. Go figure. Some people who know just a little bit about the law but not enough to do good have argued that MCL 30.417D stops the Emergency Management Act of 1976 from being read in tandem with the Emergency Powers Act of 1945. While the legal analysis is way too cumbersome to explain here at a speech at a rally like this,
Just say
the
bullshit!
result is clear. The entirety of both the 1976 Act and the 1945 Act are in full force and effect, meaning, among other things, that the 28-day time limit certainly does apply to this very situation.
It's over!
So, hope. Hope is something you should definitely have in this situation, as the actual COVID-19 data is far more palatable than what they have been telling us. And the laws we have for states of emergency clearly protect us from governors gone wild. I, among others here, am here to tell you that yes, you do have a right to fight for your inalienable rights. God gave you those rights, and no governor in the U.S. can take them away. So go ahead and wear a mask, but only if you and your doctor deem it medically necessary. Don't wear gloves in public, unless you really want to. Get out and get enough exercise and as much direct sunlight on a good day as you can. If you are immunocompromised, you should stay away from large crowds and use PPE when in close contact with others, but this is America and that is your choice. Never, like my friend Audra, never be afraid to peaceably assemble, petition your government for redress of grievances, attend public government meetings, or go in public showing your face without a mask. Thank you, everyone.